thank you for joining us this afternoon for this EURORDIS Rare Disease Day Policy Event 2014, which is entitled Improving Access to Rare Diseases Care, the Vision of Patients. And to start this day, we'll have first a welcome address by Dorica Yann. Dorica Yann is the president of the Romanian Prader Willi Association and also of the National Alliance Rare Disease Romania, and she's an officer on the board of EURORDIS. And Dorica is addressing you for this opening instead of Terkel Anderson, because Terkel, the chairman of our board, which many of you know, is prevented to join us for this afternoon and tonight and tomorrow for health reasons. You know that he has hemophilia, and also because of that he has also hepatitis C and HIV. So he has to cope with 3 diseases at the same time. And while in fact in some countries like in France probably he will be on sick leave permanently, the laws in Denmark has been changed so that they are more restricted in order to save money, which is probably happening progressively all over Europe, but also that you are supposed not to work for a longer period before you can retire. So although his health is declining, he's still obliged to work, and he has to compromise between his volunteer activities and work. And he will have a surgery of his knee to be replaced in a few days. So for that reason, he cannot be with us. And he conveys apologies to you, and he wishes a beautiful event. Thank you. So now I turn to Dorica.
Thank you, Yann, for the introduction. This event marks the 7th Rare Disease Day, an event that has taken on greater momentum with each passing year, raising awareness around the world for the common challenges patients and their families encounter in living with rare diseases. Rare Disease Day 2014 has the theme of care, with the slogan, "Join together for better care." That is exactly what we are doing here today, joining forces as a diverse group of stakeholders, including policymakers, industry representatives, scientists, patients and families, all coming together to see how we can improve access to the care rare disease patients and their families need and are entitled to receive. This year, 2014, also marks the 15th anniversary of the adoption of the European regulation on orphan medicinal products. To celebrate this, the EURORDIS policy event today will focus on 15 key questions, exploring 3 topics around the theme of care for people with rare diseases. In your welcome pack, you will find these 15 questions and some note paper if you want to take notes. Each topic of today's innovative format begins with the vision of patients, as Yann said in the beginning, for what is needed to improve access to different kinds of care. Caring for people living with a rare disease has many facets. Some patients have access to medicines, while others have no treatment available at all. Some patients are fairly independent, while others require intensive physical assistance and equipment. Care can consist of special devices, expert medical consultation, physical therapy, psychological support, social services, medicines, respite care services for family members, and much more. For most children and adults living with a rare disease, primary care is provided by family members. Besides patients and families, healthcare professionals, researchers, pharmaceutical companies, and policymakers also frequently feel isolated in their struggle to find and provide care for rare disease patients. Experience shows that bringing together scattered knowledge and resources is the most efficient and effective way to mobilize the care patients and families need and expect. In Europe, there are several areas where access to rare disease care is advancing, shaping policies to improve access to medicinal products, identifying and improving access to specialized social services, centers of expertise and European reference networks for rare disease, national plans for rare disease in European Union member states. The many different facets of rare disease care represent a universal need for patients and their families in Europe and beyond. Advocating at the local and national level to improve the lives of rare disease patients and families is still necessary. Before we embark upon our adventure into exploring ways to improve care, we invite you to watch the official Rare Disease Day 2014 video. Produced in Barcelona by the company These Glory Days, this year's video beautifully shows the many different forms care can take. Please enjoy the video.
Thank you. I'd like to say thank you to the people who developed this video, and particularly to Laura Chappelle, who is here, who worked on it for a long period, and that was not an easy exercise. All the persons that you see on that video are real people affected by rare disease. There is no actors. The video is available in 20 languages already on YouTube. And there is two versions, this version, but there is also a shorter version of 30 seconds, so that you know. Let me mention a few practical points about the format of this afternoon. First, we wanted to make this event this year a little bit different than the previous one. We don't want to be repetitive, and this year it's less of a specific political focus as we had in some previous years. We're not discussing any specific directive or regulation or elements like that. It's much more about care. And for that, we felt it would be important to have a format of 3 hours where there will be first vision of the patients to start with. What is their vision 5 years, 10 years from now to really create a change on the team, which will be discussed by the panel right after that. So we will discuss around 3 themes this afternoon. We will start with empowering people with rare diseases and families. Then we'll discuss addressing the unmet medical needs, which are huge, and improving patient access to quality care and innovative treatments. And for each of these sections, there will be one patient representative presenting to you the patient vision, and then a panel of which will discuss around 5 questions in each of these segments. So we'll have to be very careful with time in order to make it lively, both for the panelists themselves, but also for you, so that you have about 10 minutes of question and answers. And in fact, also to make you life easier, you have in your package these notes where you can take your notes from the discussions on each of the questions. So you see we've really prepared your homework already, so that when you go back to your office or to your patient group, you have already all your notes well organized, and you have this little page also on your package where you can put your questions. And please, you will then distribute them to either Lara on this side, and I'd like to have someone on the other side also. Ariane, thank you. Maybe Ariane here. And they will pass them to Flaminia and Valentina here. We will select them so that we can have lively discussions. Also, all the photos you will see behind us are from the photo contest which EURORDIS has organized every year, and which has organized with great success this year. You will see these photos are really tremendous way to convey the message about care. And the last message to tell you is that everything we're saying is being recorded on a video back there. And last year we had 600 viewers of this event on the website. So the outreach is much beyond who is in this room.
Don't try to start something unless you care.